Hi, everyone. I'm Anica Bulter. I'm the Ideas Editor at the Boston Globe. Welcome to this Globe Op Talks on pregnancy and parenting during a pandemic with Emily Oster. Globe Op Talks is a new series of conversations we've launched in which members of the Boston Globe editorial board interview world-leading thinkers and unique voices. So I'd like to welcome our guest, Emily Oster. If you're not familiar with her work, she's the author of two books that are currently on my nightstand, Expecting Better and Crib Sheet. And Emily uses data to help parents assess risk and make the choices that are right for them and their family. So thanks, Emily, so much for joining us.
I'm super excited to be here. Thank you for having me.
Great. So let's just get right into it. Right now, I'm expecting, and I know a lot of other people who are expecting right now in the middle of this are really worried about going to the hospital in the middle of a pandemic. In Massachusetts, we're right in the middle of the peak or the surge in cases. So I've heard from some people who are opting to do home births instead. What advice do you have, or how do people weigh whether they should continue on to the hospital or give birth at home?
Yeah, so I think these are pretty complicated questions. So I talk some in Expecting Better about the sort of concept of home birth in general and thinking about is that the right thing for you? And I think that for some people that choice I think is a reasonable one, particularly if you do it with a trained provider and you have good resources and an ability to get to a hospital if you need to. So I think that there's like for some women that's a good choice in the sort of like normal times. The kind of question of should I switch to a home birth at the last minute in the middle of a global pandemic, I think is like a bit of a more complicated question, because on the one hand, there are some risks away in the hospital. I think it would be inappropriate to sugarcoat, like even with the best protection, that is a place where you could become infected with COVID, which is also true of the grocery store and other things. But I think it's fair to say the risk has gone up. On the other hand, the risks associated with a home birth have probably also gone up. So your provider for the home birth could have the coronavirus. It's a lot of asymptomatic infection. The protection that they're going to be able to take is less than the protection in the hospital. If you end up needing a hospital transfer, if you end up needing to go to the hospital at the last minute, now you're coming into a hospital that is in a worse situation, coming emergency room. That's probably much worse than coming into labor and delivery. So I think some of those risks have gone up at the same time. I also think even in the absence of this, if people ask me, hey, I'm 38 weeks pregnant, I'm deciding maybe I'll just switch to a home birth. That seems like, there's a lot of preparation that goes into finding the right provider, thinking about how you're going to do it, planning for how to labor in unmedicated ways. So most people would not suggest that you make that decision very close to the end of pregnancy. And I think for that reason, there are a bunch of factors that probably push against at least that being like a choice that many people are going to want to make.
So it sounds like if you're making the switch at the last minute, it seems like it's not a great idea to do that.
I think that's right. Yeah.
So what do we know about the risk to newborns of COVID?
So fortunately, the data on sort of like the data on kids and infants and newborns is pretty reassuring. So sort of one piece you could ask was, do infants get infected from their moms, either in utero or afterwards? And the question of whether they can be infected in utero, I think, is an open one. Most of our early data suggested no. Now there are some cases where maybe the answer might be yes. But you can, in fact, infants can be infected of COVID. Infants of moms who have COVID can be infected, but their outcomes are extremely good. They actually, in most cases, don't really show any symptoms. And so, we know that they have the virus from testing, but not from symptoms. And if you look at, it's a bit morbid, but like if you look at like the number of deaths from the coronavirus, from COVID-19 in the US for people under 14, in the course of the epidemic, there have been 3 reported by the CDC. And that number is, that's a pretty small number relative to the overall number. So it just seems we have like a lot of evidence increasingly that infants and kids tend to get very mild infection and also that it's like harder for them to get infected in the first place.
So that actually reminds me of the New England Journal of Medicine study that came out, I think, last week about
yeah.
Yeah, they were testing pregnant women in a hospital in New York City and found that I think it was close to 14% of them were infected with COVID but didn't show any symptoms at all. What do you glean from that?
Yeah, so I mean, I think that that kind of tells us a few different things. So one is it's a piece of evidence, and we have a bunch of increasing evidence in this direction that there's a lot of asymptomatic infection. And so in that population, they tested, I think, 255 women, 4 of them were showing symptoms and all had the coronavirus, but another 29 of them had no symptoms, but tested positive. And so that, and later one of them, something between 1 and 3 of them may have shown some symptoms. Sort of putting that all together, it's something like, 80 to 90% of this age group was totally asymptomatic. That's a high number, but I think increasingly it seems like probably more than half of infections have no symptoms. So on the one hand, I think that that's reassuring because it makes us think, okay, a lot of people have very mild infection. And so, if you become infected, there's really quite a good chance that you will not be very ill. On the flip side, I think it has made people worry a bit about things like going to, when I go to the hospital, like, am I going to be exposed to a bunch of people who are infected and they won't be able to effectively quarantine because you won't know that people are infected. I think again, to sort of be more reassuring there, in hospitals, they are effectively treating all laboring women as if they are positive for this. People are wearing masks while they labor. They're really, really, really restricting partners and visitors. And so they're kind of doing everything they can. Doesn't mean you couldn't be infected in that situation, but it's a very high rate of kind of caution is being taken.
Do you read anything into it about maybe pregnant women there's something more protective about pregnant women, that they're not getting as bad of symptoms as other populations, or is it too early to say from that?
No, I mean, I think it's consistent with the observation that young people don't seem to mostly have fairly mild cases here. I mean, if we look at the age gradient of who is being hospitalized and who is dying, it really skews very old. I mean, a place like Rhode Island, which has had a pretty, we've been lucky to not have a very significant spread, but almost all of the deaths that we've seen are in nursing homes and congregate living settings. And so it's really like a lot of, it seems to be that the virus is very, very bad for older people, but most of the infection in younger people seems to be pretty mild.
I want to ask you one more question about giving birth at this point right now, since I'm really thinking that's what's on my mind.
That's what you're thinking about.
Yeah. So in New York, there were a couple of hospitals, private hospitals, that for a few days were not allowing laboring women to have any visitors at all. Yeah. They've since changed that, but a lot of hospitals, including the one that I'll be delivering at, is allowing one visitor only. And so a lot of people are concerned about that, not having all the support that they need. Personally, I only plan for one visitor, but do you think that is bad that people can only have one visitor, or do you think that the net positives outweigh that?
I mean, I think that, when they push this to kind of, we're not having any, like, there's no partners, I think there was a lot of feeling that kind of that maybe went too far, and that the kind of support that is provided by having a partner there is worth a lot. Actually, particularly for kind of women of color who sometimes have trouble, like where the sort of concerns can be ignored. I mean, this is a big issue that's right. Outside of the coronavirus context, has come up a lot in the last couple of years. And so I think the idea that people should be doing this alone with sort of no one to advocate for them and no one to kind of watch over them, I think that's really, maybe there would be situations in which you want to do that, but it seems very, very extreme. Of course, there are advantages to having a doula and having your mom, and people want that. It's something that I wanted, but there is this calculus about, you're like, the more kind of people you're letting in, the more infection is around, particularly if people are asymptomatic and you can't screen them well. You want to be screening everybody. Maybe if we could screen everybody on the way in for viral load, that would be one thing, but we can't really do that. And so I think they're kind of walking a fine line, and I think different people could make different judgment calls about that, but certainly this seems like not an unreasonable direction to go.
As far as the screening that you've heard about for laboring women and their people coming in, have you heard of any like really best practices for that?
Mm. I think the best practice is to try to test everybody on the way in with a sort of rapid PCR. And we don't have great access to that yet. And so a lot of this is being like I think in that New York study, they like swab people, but then the results came later. So,
Right.
Your sort of ideal would be like, we swab you in the waiting room. And, if your partner, we swab you and your partner. And if your partner is, positive, like, unfortunately they can't come in. But we're not close to doing that at the moment. That would be the best practice.
Right. Yeah. At the hospital that I'll be delivering at, they've mentioned that everyone will have their temperature taken. So if you've got a fever, you can't come in, obviously. And then everyone will be wearing masks.
Yeah, but if you calculate, if you sort of thought, okay, well, like, let's say, 70% of people are totally asymptomatic, and even among symptomatic people, fever only shows up in about half. And so now we're at like kind of, that's capturing 15% of the infected people. So, it's better than zero, but it's certainly not like if people have a fever, they have it for sure. And if they don't have a fever, they're totally fine. It's a noisy measure.
Okay, now I've made myself worried again. I'm gonna move on.
Sorry.
No, it's fine. It's fine.
Don't think about it.
I'm actually not terribly worried about it. But I do want to ask you about the effect of the effect on children who are already here. Social isolation. So there are so many kids now who are just only seeing their parents and nobody else for who knows how many months. And what do you think that is there any data out there that shows us are kids going to be afraid of strangers? Are they going to have a harder time relating to people after this prolonged period of isolation?
I think that the bottom line is we are engaged in some kind of grand experiment, like not in a good way, but like a lot of those questions are very hard to answer because the best we can do is infer from data, which is very far from what we're doing now. So like, for example, if you look at like toddlers and you ask, like, let's compare toddlers who are in daycare to toddlers who are like, with a single caregiver, and ask things like, do they have different outcomes? This is something I talk about in Crib Sheet, not in the context of, global pandemic social isolation, but in the context of just, should I send my kid to daycare? And what you see there is like, maybe there's a little bit additional school readiness and sort of socialization for the kids who are in daycare, and maybe there's a few more behavior problems also, but they're kind of like balancing out, and there certainly aren't any very large differences. So if you said, okay, well, that's kind of a microcosm because that's a sort of one difference between seeing a lot of kids and seeing fewer kids, like then you would be, I think, reassured. On the other hand, this is a very different kind of situation. It's much more extreme in terms of the isolation, but it's also shorter. So, we don't think, God, from knocking on like my desk, but, we don't think this is like going to be like this for 2 years. So your kids are going to be back in sort of social situations. So I don't think we know. People have grown up in a lot of different circumstances and turned out, okay. There's like always, my daughter is like really into the Laurel Ingalls Wilder books at the moment. And, those guys are just like alone in their farm for like years. They never see anybody except their family. And, she turned out good. And so there's obviously like a lot of, if your kid is like happy and taken, safe and taken care of and somebody's interacting with them, it's not so, there isn't like a lot of reason to think that, but I'm not sure, like we just don't know.
Right. Among the data that does exist, as far as the daycare versus single caregiver, is there a difference in age groups for that, or is it pretty much tell you the same thing?
So, I think most of that suggests that to the extent that there are like benefits in daycare, they come when the kids are a bit bigger, because they're sort of about like school readiness stuff. And to the extent that there are costs, they come when they're a bit younger, but these are all like really small differences.
Gotcha. Okay. So a lot of parents are homeschooling right now. I think you're homeschooling your two children.
Too. Absolutely. Yeah, it's great. It's going great. I'm great at it. Totally awesome. Couldn't be better. Yeah.
So exactly, there are some parents who are just giving up on it, who are trying to work full time, and they're realizing that, okay, I can't do this. I can't also teach and be working. And so they're doing things like letting their kids read or allowing them to play and or choose their own activities. Do you think that there's any reason to be worried about kids like missing out on structured schoolwork or school time for this semester?
Yeah, I mean, I think that these, yes, I mean, like, of course, it would be better if our kids were in school. That would be better. I think one thing that is fortunate is that the sort of like distance learning options work much better for older kids. So if you sort of think like, I would be most worried about kids sort of missing out when they're older. My 5-year-old doesn't really need to learn anything right now. He can catch up on some things later. There's like, if I have a 14-year-old, I might be more concerned, but it's actually not as hard to sort of ramp up that kind of distance learning with an older kid. But I think we do worry, and I actually have been worried a lot about. I've been talking a lot about policy here around, what is this going to do to kind of like socioeconomic inequality in educational outcomes, right? So you have a lot of like parents with a lot of resources who kind of do have time, even if they're working full time, and sort of maybe it's like flexible enough that they are able to sort of do some supports to their kid. Maybe they go to schools with more resources, so the schools are providing better opportunities. Kids who are coming from less well-off backgrounds, whose parents maybe are essential workers who are still out working, who are like not able to provide these kind of supports, and the schools are not providing the supports. I think we worry about the same kinds of things we worry about in the summer. Like, is there the summer melt, the sort of inequality in kind of extra support that's being provided? And I think that is a concern that I have, and I think many of us will have, and hopefully we'll go back in this fall, and we'll have to figure out how to fix this.
Have you given any thought to what your kids will do during the summertime when there's no school and, I don't know, we may still all be inside?
I'm really holding out hope for camp. I'm really holding out hope for camp. So I'm just assuming there's going to be, no, I mean, yes, I have given a lot of thought to this, but I have found that when I start thinking about this, I get really panicky. Mm-hmm. And so my approach has been to try to think 2 weeks ahead. I think that part of this is faded a little bit, but like in the first sort of couple of weeks of this, it was like I couldn't sleep. And I was just like constantly like, okay, well, what if like, let me think like 9 things down the game tree about like, what are we going to do if the sleepaway camp is on, but the other camp is not on? What if pool club's not open? And like that, like sort of like putting all the pieces, like what, mom, well, what if we can't see my friend? And then, I was like, there's every day is a different thing. Like I have to just dial it back. So I've been trying to do like 2 weeks ahead. I actually think there is some chance that in Rhode Island, some of the camps will be open in some form. But, I think the other day my daughter was like, if there's no camp, like we're not just going to do the same thing that we're doing now. Are we? Like, I can't do any more online math. I was like, we'll do something else. So I don't know.
I can totally imagine how she must feel.
Yeah.
So I was going to ask you if you have any advice for parents to keep calm during this time. And it sounds like maybe just not thinking too far ahead might be part of that.
Yeah, I think this is a time both sort of not thinking too far ahead and also trying not to worry about things about which you have no control. Right. So I think there's a lot of like anxiety and fear, which of course like is totally natural and we are all experiencing for good reason. But, the fact is like, even if you thought that this was somehow very problematic for your child's social development, there's nothing you can do about that. And so, you can't control that. And I think part of what's hard about parenting, like all pieces of parenting, is the sort of times when you realize I can't do anything about that. Like that's like out of my, I really want that to be different, but I just can't do anything about it. And I think that this is a place where thinking about it isn't helping. And it might be better to just try not to think about it and try not to like worry, try not to add that to the sort of scope of worries, unless you think there's some decision relevant thing, right? And sort of thinking about, is there something I can do about this? Well, there's something I can do about it. Okay, I'm gonna like accept the things I cannot change and try to like, serenity prayer, like move on a little bit about that.
So there will still be people who are thinking about it. And
no. I'm thinking about it all the time. I just want to be clear. Like sometimes people are like, oh, you must be the most relaxed person. No, I'm thinking about this all the time. It's all I'm thinking about. I just suggest you don't think about it because I don't think it's helpful.
Gotcha.
Learn from my mistakes.
So I know part of what you do is you're looking at data and you're looking for good data. And one thing that I love about your newsletter is you're taking the existing data that's out there and really parsing it and helping us understand it. But it seems like it's a weird time. There are so many numbers flying around about COVID, yet it also feels like there's not enough information. So what are some sources, if parents are going to think about it and they are going to read about it, what are some good sources for reliable information and reliable data that can actually help us make sense of things rather than just making us worried?
Yeah, I mean, I think, it's, this has been really hard because, for example, like there's like new studies that come out all the time. And the like statistics of those studies are actually like really complicated in a lot of cases. And then you sort of like, if you're a person who enjoys statistics, you can like read Twitter and people are like, oh, this study has like, well, what about the sensitivity of that test? Like, blah, 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 blah. And you're kind of in the weeds with people who don't really totally understand exactly how that works. So it is hard to put that together. I've actually been talking with some people about, is there a sort of a more formal way we might be able to put together some of this kind of data. But if you want to sort of think just generally about like epidemic tracking, is actually some really good options. So like Johns Hopkins has a really helpful website. And the CDC has, has been doing at least some reporting on kind of deaths and ages of kind of looking at kind of hospitalizations and outcomes. But there isn't like a great explainer thing I would point to.
Right. Well, I think I would point to your newsletter as a good source for parents.
Yeah, well, okay, sure. Read my newsletter. I'll take the subscribers.
Look for the newsletter. So I think I'm going to go ahead and kick it over to Chris, who has some reader questions to ask. If
Awesome.
Chris wants to join us. Hi.
Hey, Chris.
Hi, Anica. Hi, Emily. Thanks, guys. Hi, everyone else. Just want to take a quick moment to say thanks to all the Boston Globe subscribers who are attending right now, joining us live, asking questions. We couldn't do this without you guys, so thank you so much. One question that has been asked in maybe 15 different ways over the last few minutes from both grandparents who want to see their grandchildren and parents looking for help with young children. Based on your understanding of the virus's contagiousness, do you think it's 14 prior days of isolation and nothing else? Or are there strategies that you've heard of or are thinking through that might allow grandparents to see their children or parents to seek help from their parents?
Yeah, I mean, this is so hard, and I would say it's something we've been talking a lot about in my house also. And I think part of what I think I am finding very, very hard is, we had this idea like, okay, we're going to do this, and we're going to wait, and we're all going to isolate, and we'll, and then it'll just okay, and then we'll just like see you again, and now as I'm thinking about it, I'm realizing, well, my kids are going to go to this camp that I'm imagining is going to be open. They're going to go to camp, and then, they may well be exposed to this, and sort of that's going to expose us, which I'm less worried about. But then, then maybe I'm not going to want to see they're not going to want to see their grandparents after that. But, now we're talking about like waiting until there's a vaccine. And, I think that's really far, like somehow we sort of get down the tree and it feels like there's like somehow at some point that's not really feasible. But as long as I'm going to eventually see them, well, maybe there's really no reason to wait to see them, because unless I'm going to wait until January, I'm not. So I think this is the kind of, I realize this sounds a bit scattered because I'm still trying to think about, how I want to process that. So I think, maybe be kind of like maybe the right way to chunk this is sort of in pieces, and to say first, let's imagine that you have it's you and your toddler, and, you have a healthy, like 65-year-old mom, and she's been isolating and you've been isolating, and now you want her to like come live with you, and you were going to continue isolating. I think that seems like, okay, like that's in line with the sort of like keep your pod situation. Then a more complicated thing is, well, I want to go visit them. And, we've been isolating. That's probably, sort of still within the range. Now it's like, well, I'm going to send my kid back to daycare, but my mom's going to be with them 1 day a week. That's more complicated. There's a reasonable, there's some chance your kid's going to get the virus at daycare, but you may, but then you may want to have, you may want to have that conversation with your parents about, and think a little bit about, what is how are we evaluating the risks given, the sort of situation for your particular, do you have like a healthy 62-year-old mom, in which case, the risks are a lot lower than if you have like an immune compromised 85-year-old dad, where I think the risks are pretty extreme. So, and I would extend this, I think in some ways, these same questions this is also the question about something like daycare or school or camp. When I send my kids back there, even if the daycare is as careful as possible, and we can definitely lower the risks, and there's tons of things we can do, and they will do these things, and that's great. There is still a reasonable chance that your kid is going to get this, because we know that when we send kids to school, when we send kids to daycare, they touch other people, right? And we're having these conversations about college students. Should we bring the college students back in the fall? And what are we going to tell them not to touch each other? Like, that's what they're doing here, and they're here to touch each other. And so I think some of what this conversation is going to need to evolve to, both within families and then in the sort of broader policy space, is just trying to think about how do we move forward, knowing that it is going to be a while before we have sort of either herd immunity or a vaccine, and we're probably not going to want to put these interactions on hold for that long. Got it.
This one comes from Marissa H. Question is, if things do begin to open up in the coming weeks, months, pregnant women will likely still be considered high risk. Do you have thoughts on how women and their partners or others living in their home can and should manage expectations of returning to places of work, and how employers can do the right thing for their employees that are in this situation?
Yeah, I mean, I think that what my guess is most employers are going to try to adopt some kind of as flexible as possible a working policy that reflects the fact that that there are going to be employees with different risks, both different risks and different risk tolerances. And so, if you are pregnant, yes, you're probably not actually. I don't think we think you're higher risk, but there may be other reasons that you are less interested in being exposed. And I think we're going to need to push employers for flexibility that goes in both directions, right? So I think that you guys hear my kids screaming in the background. Homeschool. Yay. Okay. I think we're going to need to push people to kind of try to try to be respectful. And I think it does go in both directions, because I think if you have, a lot of the kinds of policies we're talking about are okay, people over 65, can't come back to work, can't do that. And that's not an unreasonable policy. On the other hand, I'm not sure that the world is interested in saying, well, if you're a 66-year-old person who wants to come back to work and there's no real, you're an adult. And so kind of how are we going to balance those things? I think that's something that's going to be pretty complicated. In some ways, that direction is more complicated than saying, we need to provide accommodations for people who want to continue to work from home if their job is sort of allowing it.
Cool. Yeah. This one was submitted anonymously. It's from someone in a particularly new family dynamic. She's sheltering in her child at home for the first time as an adult with her newborn, and in a way is being parented herself. Do you have any thoughts for that kind of situation, but under the lens and in this bubble that we're in right now?
Yeah. There are a lot. No, I don't have any great advice there. I mean, I think that this has sort of pushed all of us into, or many of us into kind of situations that are sort of socially different, where we have a different set of interactions and a different set of sort of engagement. So, maybe, if you're know people who are their nanny is still around, but they've moved their nanny in with them. And so now you're living with sort of a different person, and that's going to change that relationship. And sort of similarly, living with your mom when you have newborns, probably great in some ways, and probably pretty complicated in other in other ways. And I think that in some sense, like acknowledging that is, I think, worth a lot, and just sort of acknowledging like, okay, we're in kind of a weird situation, but we're all trying to make it work, but not expecting it to be somehow like awesome. Right. And and I think that was I think early on there was sometimes it was sort of like, this is going to be like a fun adventure. We're all going to be like on this adventure, brief. Okay. Like, not that was like, but I think there was some, always when there's a new thing, it's like, well, let's bake, let's like and then I think now we're in the phase of like, more bake, it's sort of like the reality is coming. I think just acknowledging like, it's hard. Like many of us are lucky that we're not sick. Lucky that we have resources, but this is a challenging situation, and it's not like helpful to pretend that it's not.
Yeah, and there's no more yeast on the grocery store shelves.
No more yeast. No, I bought a large thing of yeast before the grocery stores, so. Yeah. But now there's no flour, so.
Right. I will ask one more before turning it back over to Anica. Based on the published information and what you've seen so far, are you adequately convinced that in utero children are not impacted by COVID-19? Or do you feel like there's still work to be done?
You mean, is there vertical transmission?
Yes.
No, I mean, I think it's still unclear. So I think when I look at that data, for the most part, infants of COVID positive moms do not end up COVID positive, independent of whether it would be like in utero or later. Like, mostly they don't become infected at all. It's actually pretty hard to test whether they, whether they've been infected with our sort of current technology. Testing whether they were infected, to the extent they are infected, whether it was in utero or later, requires better antibody testing. And our antibody testing is getting there. The ELISA arrays on this the ELISA arrays are getting better, but they're still not super widespread. So I think that there are some teams, actually, I think there are some teams in Boston that are going to be doing retrospective testing of things from newborns in the past, few months. And then I think we will know the answer to that question, but I don't think we know yet. Certainly does not seem like it happens all the time, or we think we would know, but is it possible? Sure. I think we don't know yet.
Great. Thank you so much.
Yeah.
So I have some follow-up now based on our reader questions, which were all excellent questions. But as you were talking about, I feel like right now people are really, the whole pregnancy experience is being upended by this virus, by this pandemic. And people are worried about losing their community, and not having grandparents around, and not having the usual friends come visit and see the baby.
Yeah.
But it sounds like, as you were talking about answering the grandparent question, that the risk is less to a baby and more to the vulnerable populations who might get sick from that. Am I interpreting that correctly?
That's right. Yep.
Okay. So you could create situations in which you could see your family, your grandparents or family, if you thought that was the trade-off was worth it.
Yeah, I mean, I think I am more worried about I think the data would suggest we should be more worried about the grandparents than the baby. Yes. And so I think you can imagine creating a situation, for example, where after the baby is born, you isolate with the baby for a couple of weeks, and your parents, hopefully your elderly parents, are also isolating anyway. And then you see them, that would sort of limit the chance that you are infected. And then, but I think that's, the concerns I would have with an infant are the same kinds of concerns I would have with infants exposing to any germs, which is just, if your infant gets a fever in the first 6 weeks, they're going to need a spinal tap. And so that's like a kind of that's a reason not to expose them to anything. But actually, most of the other things that they would get a fever from are worse than this so you don't want your infant to get the flu. You don't want your infant to get like a bad cold.
And so you want to take the same precautions, like having visitors make sure they're vaccinated against,
the flu.
Yeah. Okay.
Yeah. But but I think we're more worried about the grandparents.
Okay. That's actually really reassuring, at least to me, maybe to others. I want to ask you one more reader question before we wrap this up. One of our readers, online viewers, wants to know, do you know of any studies that are taking place right now that pregnant women can enroll in to help us get more data about what's happening?
Yes. So there's at least one thing at UCSF, which you can, if you Google pregnancy study UCSF, there is a study going on there. I actually think there may also be some studies going on at the Brigham or some of these other, but I don't. But the UCSF one is the one I know about. But if you are a pregnant woman, I would suggest you ask your OB, because my guess is that if there are studies, they're doing like a lot of recruitment.
Yeah, I think that's right. It's a good advice to ask your OBs. I believe there's also a study out of MGH, but I'm not certain of that. But I think that that's an excellent thing to do, is just volunteer.
Yeah, volunteer. And I think, volunteering for this stuff is like super important, because, we really still have a very poor understanding of the extent to which certain populations are infected or not, how asymptomatic people are, what does serology look like, were a lot of people infected before. And these are the things that we need to know in order to reopen and sort of move forward.
Okay. Well, thank you so much, Emily, for being with us.
Thank
This
you.
has been really helpful and reassuring to me. So thanks, Chris, for the reader questions, and thanks to everybody for joining us today for this Globe Op Talk. And this is an experiment, so we'd love to hear your feedback on how you think it went. So anyway, thanks, Emily.
Thanks, everybody.